Hey everyone, how's it going? It's been a long time since I recorded a video. Hope all is well. So today I want to talk about a topic I think I talked about before, and that's how OT can be very versatile just as a career. I think most of you guys going into it already know if you're a practitioner, if you're a student. So I guess this is more geared towards those who are in pre-OT, but even those, or even practitioners, or maybe you've been in the field for like many, many years and maybe feeling a little bit burned out. And basically, the main topic I want to talk about is just how OT can be a career that just never gets boring and you can do so much with it. Those of you know with me, kind of worked in adults in acute rehab and working in acute care, and I really thought my career would be in adults and geriatrics. And I had a really good career with it. And just one day, I decided maybe I should try other things, right? Mental health, pediatrics, or maybe more specialized areas. And I kind of didn't have a choice because my son was born and I just saw how awesome pediatrics was. And not only that, but I also sustained a back injury outside of work and really meant that just natural kind of progression was for me to kind of look into pediatrics. And the cool thing about just OT is how you get, if you're becoming a generalist, you can exposure to all three of these areas, right? Adults, pediatrics, and mental health. And for me, it actually wasn't a direct transition into pediatrics. What I did was actually I did even more specialized areas because what I was doing is just looking for work on the side. So some of you may have this luxury, with being able to find some part-time or per diem work. Some of you may not. I totally understand. You have student loans, you have, life, you got to pay rent and stuff, right? So you may or may not be able to swing this. But one thing to consider is being able to just find work on the side and just naturally transitioning out of the field or setting that you're in. Let's say population, right? And that's totally doable. You can transition from, say, full-time going into part-time, and with all that time that you have freed up, you can use that to look into other work, right? And that's kind of what I naturally did. And I learned about these things. You guys probably learned about these things, but for example, right now I'm actually on my way to a gig and I'm doing FCEs, functional capacity evaluations. And basically the gist of that is I go and do a 2.5 to 3 hour, basically it's an evaluation of clients who are on workers' comp or on disability, and I test them to their max capacity of how much they can lift. It's a lot of stuff you would think you measure, like range of motion, manual muscle manual muscle testing, excuse me, and I get to be a little bit creative and testing to what they do in their job. And I love it because I get to meet clients and just really talk to them, and I don't have things like time being like a factor. I do have to write up a report, but once you get really used to it, it's like not even stressful for me, and it takes some creative thinking, and it's not like every day is like the same, and I love that. And I do that on the side, and that can be either per diem work for those of you who are looking for that, or it can be contracted work. And for me, I'm doing contracted work. It's kind of nice because I get to make my own hours. I get deductions, and I supplement that with my other job, which is for pediatrics. So that was really nice having this cushion here where I can make, as much money as I want, basically getting more hours and just putting in more availability or just as needed. And that's really, really nice, and during these times when it feels like our money doesn't go really, really far, right? And it's great. I get to have downtime. Those of you who are like road rate warriors, you may be a fan of this. If you're not, then maybe not. But I get downtime to listen to podcasts, listen to music, and just practice my mindfulness, right? So I love it. And the money, with for example, contract work, it can be variable. So if you want consistent income, I know there are a lot of practitioners out there who just do multiple jobs. Right? It's kind of like having, for example, multiple per diem, right? And so that is really, really nice. So the natural question is, how do you transition into these settings? And with this FCE job, my boss basically was willing to train me, and it was all like online training. And you know, if you become an OT, or if you're in OT school, you can learn to do an FCE or any other specialized thing that it's just very specialized, right? Just to learn very particular kind of like procedures and particular way of documentation. But other than that, you can swing it and get it done, and that's really nice. So that's really nice. For example, I do that. I set my Mondays open for that, and so that's like as needed. And if things are a little bit slow, I can actually pick up other gigs for my other job. So what I was getting to was, well, how do you transition then, right? Like, you learn about these things, but what if like I started off in peds, I want to go into adults, or I want to start off in peds and want to go into mental health, or adults into like peds, or adults into mental health, or mental health into something else specialized, right? It can seem like you don't have that experience, right? You look at all the job applications, they all say like, oh, certain amount of years, for example, required, right? So I'll use myself as an example. I didn't start working out in peds right away. I started out working in adults. My only exposure to peds was, one, in school, so with my field work, and two, I used, during my interview with, for getting jobs, was, well, my personal life, right? And I know most of you probably have interacted with some kiddos at some point in your life, whether it be a family member, maybe you have kids of your own, right? Maybe you've babysit. These are all really good examples how you may be able to transition from adults into peds, right? You learn a lot. Even if they are, quote, not atypical or not neurodivergent, it's still experience, right? Living with, for me, example, with a 2-year-old 24/7, right? That's like a whole bunch of experience. And I use that to, describe my qualifications, right? I kept him safe. I made sure his needs were met, and I promoted his growth, right? It's no different than if I was working with a patient. It was just in my personal life. Right? And of course, along with that, I supplemented that with my experience in pediatrics, working in field work, right? Out in the field, or doing the clinicals, or those practice labs. But even beyond that, your experience, whether it be one population going to another, it doesn't matter. It's still experience as an occupational therapist. You did documentation, you work with some human, right? Whether it be a little adult, or an older adult, or a middle-aged adult, or a teenager, you're still working with them. It's still experience, right? Yeah, maybe the population is a little different, but for example, when you're working with pediatrics, you're working with the parent. It's very family-centered, right? In pediatrics, we personally have to interface professionally, with people, and that is also experience, right? So when you're working with pediatrics, your client, the kiddo, but also the family member, the parent or guardian. So that's experience there, right? And if anything, you can argue that you're talking to the adult more than the kids sometimes in some of the sessions, right? So all of it is experience. And if you describe that in your interview, even though it's, I don't have, quote, experience in X population, you technically do. And it's really just how you tell your story. And it's all about your story in your personal life, in your professional life, and your interests. And if, end of the day, I think if your passion and your drive and your motivation comes through, the interviewer will see these things and they can see your strengths, right? Okay, what about the other way? We're working with pediatrics. I didn't really quite think this through, so I'm kind of going to talk about it on a whim. Going into adults, right? The same thing applies, right? Sometimes adults are kind of like little kiddos too, right? When they act irrationally, when they just act emotionally. So if anything, you can even argue that working with adults is, quote, easier in some aspects, at least emotionally, if you have that experience working with pediatrics. Another thing you talk about as well, even though I technically, let's say I'm being interviewed, didn't work with adults and I want to go into that population from pediatrics, which a lot of OTs do, you talk to the parents, the guardians, right? You're technically doing caregiver family training. So you have that experience there. So even though you didn't directly work with adults, then you can still describe that. And kind of the last point I want to make is just really just getting your foot in the door, right? We all have a perfect dream job, right? Or an ideal job or a perfect job in mind. But that's kind of more of the end goal or the end game in your career. You don't want to think about it in that way and compare yourself to your peers where they maybe got that job already, maybe because they worked in it in field work. Then yeah, they're going to have an advantage and a leg up over you, right? But many of my classmates, like the bro-ties I talked to, really just got into that setting, that population, by just getting their foot in the door. And that can just mean starting off as a per diem job in a less than ideal, maybe lower pay, whatever, getting that 1 year of experience, right? So I don't need to go into this detail. You all know that about this, right? So for example, if you want to go into, let's say, working in a hospital, let's say from Pediatrics, right? You work a per diem job, maybe as a sniff, right? And then from there, if you worked about a year, right, you can start applying for per diem in the hospital or any of those combinations, right? And that's the great thing about OT, I think. It's very similar in nursing, is that there are so many populations you can work in, and if you get kind of burned out, kind of tired of it, you just want to mix things up, you can do it so easily. And I don't want to sound like overly like dramatic and whatever, but I want to say that occupational therapy as a profession has saved my life in a way, or just like improved it or picked me up in two ways. One, when I had my back injury and I thought my career was over, I found new meaning, new purpose through occupational therapy by doing different things. And second, some of you may have known, I try to keep my personal life out of my professional, but I'm going through a divorce right now, and career is one thing that I really just like makes me feel empowered and gives me meaning and purpose as well. And being able to break into and work in pediatrics is really just, I think, maybe something I never really considered before, but just because of my situation, that's kind of what happened. And now I'm like, I love my job as much, if not even more, as an occupational therapist. So, you can be easy to read. I'm on the freeway now, so I need to speak up. Online and get discouraged on forums, on Reddit, whatever, like people getting burned out. You don't feel like you're making as much money as, like, say, your peers who are in other, fields, really. And that may be true to some degree, but just don't be afraid to switch jobs, change it up. And naturally what comes with that financially is generally a higher income, higher salary, higher hourly, whatever you want to look at it. And that's great. You don't want to be stagnant in your pay, right? You want to keep up with your finances and the economics and inflation, right? So yeah, you may have built up a team, you may love your team, and that was one of the things that made me like really difficult to leave, but you can always cut down on the hours, and especially when you have seniority, and look into doing something new, even if it's on the side. You can even be consulting, you can do a lot nowadays with like consulting work and just being creative and just looking online. There's a lot of great podcasts out there on like starting a business, and that may sound like, oh, that may not be for you, whatever, but you're surprised how easy it is to start something new for something you love and also be able to make money from it. So let me know in the comments, guys, if you had a situation where OT has really helped you out, because just how versatile it is as a field. And let me know. And those of you who may be a little bit down and like lost, share with me that too, and maybe we can kind of help you guys figure out what we can do to make OT make you shine. So thanks for watching, and look forward to seeing you guys all in the next one.